bribery.
I mean, I'm fine with that if like they did it themselves. Be like, but 4.2, you have Alyssa. Yes, like, I'm getting a beer civic, but guess what I'm getting in college? You're not. Exactly. I'm having to stand it so hard. Yeah. I looked at it. Oh, it's just so hard.
I know.
It's like so scary.
Yeah. Korea does.
I know it is. I'm so glad.
Kids,
I'm so glad. I know that's 10 years now that I'm not even thinking about it. Literally nothing. The gates are closed for like a good year. Really? I can't wait to be a grandma. Padlock chained. You need a code. But like just for my kids. You're not here. Oh my god, no, they're gonna be screaming little balls, dude. Kennedy's
I know.
Hey, what about me?
They might be having,
Eventually.
no, they don't have both anatomy and physiology, do they?
And then they're gonna be screaming in my face. They'll be like, I was up for 20 hours. 3 hours. Unless they're like stupid mini. Oh my god. Is he okay? Leave him on the floor. I just get worried. Hear about me. I've never heard of that. I mean, that's amazing. Oh my god. That's horrible and amazing. Just be like making dinner for next month. I thought that would suffice. The thought of having to make one and then I have to go make like ravioli. I would. This sounds horrible.
That was so specific.
Making
Making ravioli. I guess the only one that like troubles you.
Oh my god. It's really hard. I have to like seal them, put them in the fort. Yeah, it's all tiring. Yeah, I'm gonna make my mans do that. I have 3 bridges. Just like wood and water.
All right, let me get started. Big thing, Wednesday, we're on Zoom, right? So I will have it for you guys on Canvas. I'll create a Zoom room with the ID and everything. So I'll put it on Canvas, you just click on that. I will be on campus, I'm doing my first class in person. And then I'll probably do the Zoom in my office, and I'm planning on starting it at 11. So it will be recorded and all of that. So it goes based on that. All right. So chapter 17. I need that Thanksgiving break too. Okay, chapter 17 is about nervous system. So we're going to look at the diseases of nervous system. From here on, every single disease has its own unique pathogen. So it's unlike the skin for those 3 bacterial infections or bacterial pathogens I said, make sure you know them. They kind of interchangeably cause different diseases at the same time. So, but here is separate. Again, we're going to talk about bacterial, viral, fungal, and protozoans possibly, and then prions here. Again, for the diseases, for the systems, you don't need to know anatomy, physiology, just if there is a normal flora in the area, and then what are the protective measures that they have. Biggest thing I want you to know about the nervous system is that the human nervous system is divided into central nervous system and peripheral nervous system. So your central nervous system is actually your brain and then your spinal cords. That basically they're responsible, again, just to save time, so I'm not over lecturing you guys today, is basically these are the areas where the accumulation of the neurons, basically your brain and spinal cord are responsible for many of the functions. Brain has different areas, the cerebrum, cerebellum, brainstem. So you can have the thinking, the memory areas is more cerebrum area, also thinking and consequences and of your actions, all of those are in that specific area. Then you have, this area also controls, like the brain also controls the voluntary and involuntary movements, muscle movements. And then brainstem mostly is regulation. So like regulation of body temperature, it has hypothalamus, it has pons area, so regulation of heartbeat, breath rate, and all of that, so it comes from there. Spinal cord mostly is, again, muscle movements, whether it's voluntary or involuntary, okay? Peripheral nervous system is where the neurons come out and go to the tissues. Now, some of these neurons are sensory neurons, so they are the ones that are responsible to take the information to the brain. And then some others are motor neuron. That's the information or the result comes back from the brain and says, do this. For some of your neurons are actually a combination of them. They are both sensory and motor, and typically those are responsible for your fast actions that you need to have. Again, I have slides telling you about what a neuron is and the structure of its cell body, axon. I don't have anything even about how the signal is formed, but so having an idea of the central nervous system being different than the peripheral nervous system, that's important. And also the big one, the one that was missed mostly on the exam, microglia. So microglia are the fixed macrophages of the nervous system. You find it in the central nervous area, not specifically next to neurons, but in the cerebrospinal fluid, in the areas that the blood-brain barrier exists. Now, as far as other protective measures, the central nervous system has another additional protective measure, and these are called meninges. So your skull is basically covering your brain, and underneath it there is 3 layers that are called the meninges. Same thing with your spinal cord, is inside your back, the spine, and then underneath that, between the bone and the neurons, the spinal cord itself, you have the meninges. We have 3 meninges. Dura mater, arachnoid matter. I have another image further down here, shows it. So dura mater, arachnoid matter, and pia mater. They are supposed to create basically a barrier between blood and the brain, and then also so a chemical barrier and also a physical barrier. Between the first 2 layers, the dura mater and arachnoid matter, that's where there is cerebrospinal fluid, so CSF, cerebrospinal fluid, or short we refer to it as CSF. That is the area filled with blood, with cerebrospinal fluid, with the fluid. That's where basically the blood-brain barrier is, that fluid. So everything that needs to get to the brain and to your central nervous system goes through that area in the cerebrospinal fluid and from there. In addition of having that fluid also provides mechanical protection. The mechanical protection is basically, with the fluid and the spaces there, so your neurons are not hitting the hard bone and getting damaged. Okay. Also, The cerebrospinal fluid is azenic, and technically the central nervous system itself is azenic. The cerebrospinal fluid is supposed to be azenic, absence of any normal flora in these areas. And technically, your peripheral nervous system is supposed to be azenic also. Why? Because the neurons are coming and they are in the tissue. They are never out, or they don't cross any of your other barriers. So they don't cross the skin, they are underneath the skin. They are underneath the mucosal membrane and all of that. So they are supposed to be in an area of your body that is also azenic. All right. Finally, there is, as far as the other immunological responses and reactions associated with your neurons, we say that central nervous system itself is immunologically privileged. Now, most people think, oh, does that mean they have special things associated with it? It's actually the other way around. The immune responses in central nervous system is weakened. You never get a full immune response in the area because inflammations, that means you would have a high level of inflammation and all of these white blood cells and everything getting access to the area. You cannot have that because neurons, after a certain age, they stop dividing and reproducing. So if they get damaged, they cannot be repaired. And inflammation itself, many times, as we will see in meningitis, is the cause of damage to the central nervous system. So because of that, our immune response is much lower and less than anywhere else in the central nervous system. Peripheral nervous system, no, not necessarily, because you have all the tissues, normal tissues surrounding these. Now, since you have the blood-brain barrier and all of that, getting access to the nervous system, especially central nervous system, is difficult. Peripheral nervous system is not that difficult because you have the bacteria in the tissue, they are right next to your peripheral neurons. But central nervous system itself, it has that blood-brain barrier and it has the meninges. So access should be difficult, especially for pathogens like bacteria, funguses, protozoans. These are large, right? So passing through this blood-brain barrier is hard for them. Many times it's because of damage to one of these barriers that central nervous system has that gets in there, like the broken bones and things like that. Or in some cases, like for example, sinuses, the area of sinuses in the skull, the bone is extremely thin, and in some cases for certain individuals, it's more porous, so you can get access to the nervous system that way. But in most cases, what ends up happening is the pathogen gets access via peripheral neurons, and via peripheral neurons travels to the central nervous system. So many times that's the case. Okay, so we're going to look at bacterial, viral, fungal, and then prions. I will have some protozoans, but it's just very rare to have it. Okay, bacterial diseases. Again, bacteria, because they're very large, it's very hard for them to get access. Most often, they are getting access either via peripheral neurons, or they are affecting the cerebrospinal fluid itself or meninges itself, and that's how they can cause damage in the central nervous system. Many times, it is actually their toxin. They produce neurotoxins that now affects your central nervous system or your peripheral nervous system. So first, we're going to look at meningitis. Now, I have bacterial meningitis, but I have to tell you guys this. Meningitis is one of those type of diseases that is actually an accumulation of certain signs and symptoms and inflammation of meninges. We just refer to that as meningitis. Meningitis can have many causes: bacterial, viral, fungal, protozoans, and so on and so forth. And within those, like bacterial, we could have many different types of bacteria that cause meningitis. So any inflammation of meninges is called meningitis. There's a group of signs and symptoms that is brought on whenever you have meningitis, inflammation of meninges. So first, I'm going to tell you about that. What is meningitis? Consider meningitis. Then I'll give you guys like the bacterial causes, some of the most famous ones. Then when we get to viral infections, I will talk about viral and so on and so forth. So meningitis is inflammation of the meninges. So this is what a healthy meninges look like, and these are inflamed ones. When they get inflamed, they swell up. When they swell up, they have nowhere else to run. So they will actually be right up close to, they get to the skull, and from there they have nowhere else to go. So therefore, their swelling basically starts penetrating the space of your brain or spine and start by putting pressure on those neurons and then causing damage, permanent damage, or partial malfunction in the areas. Depending on where it is associated or starting at, first of all, in all cases, you might have a fever associated with it. Degree of fever, depending on the pathogen, can be different. Higher, lower, it can be different. Now, if it starts in the skull, so meninges that are underneath the skull, we refer to that as the cranial meninges. So inflamed cranial meninges obviously starts putting pressure on this area, and you will have a severe headache. The headache would be so severe that it would be associated with vomiting, you know, sensitivity to light, things like that. Like having migraines are pretty bad. This is even more than a migraine, so it's really bad. Changes in personality of the person, being irritable. In babies, you can actually have them staring and not basically blinking properly and having this dissociated kind of a sensation with them. Person can become lethargic, being very tired. Then you could have it associated with spinal meninges, starting at the spinal region. Again, high fever, but one of the interesting parts of it is the inflammation of the meninges, back pain, and the neck region. So the neck, basically any movement to the neck is very painful. One of the tests that they want to do to see whether or not is meninges, because even if it starts in cranial region, it will go to spinal, spinal goes to cranial, is basically this. They ask the person to take their chin and bring it down. They cannot do that. It's extremely painful. For the spinal, because a lot of control is via your spine, your movements are like muscle movements. You can have muscle spasm, irregular muscle movements, like the person cannot grab something properly. One side works worse than the other side. Some other signs and symptoms that you might see in children, we can see what we call petechiae. So petechiae, this is little tiny hemorrhaging of capillaries on the surface of their skin. So it bursts open and you have hemorrhaging and you have these little spots all over. Again, if it's getting more and more severe, coma, behavioral changes, inability to walk, all of that can happen. For diagnosis, regardless, when they suspect it, they actually do the signs and symptoms and all of that and do this with your chin. The next thing is they will take a sample of your cerebrospinal fluid. So CSF, they do a spinal tap between lumbar 4 and 5 typically, and they extract cerebrospinal fluid. Now, cerebrospinal fluid is supposed to be absolutely clear. There's a certain amount of sugar and other things that are present there at all times for the brain and central nervous system. If your cerebrospinal fluid, spinal tap, is cloudy, that immediately is a sign for meningitis, all right? And then they do a sugar test on it, and it is typically low. So So why do you think it's cloudy? What could make it cloudy? Bacterial growth, fungal growth, protozoan growth. It could also be cloudy because your white blood cells are traveling to the area. Low sugar. What's using the sugar? The bacteria, the fungus, and all of that. Interestingly enough, if it's a viral meningitis, your spinal tap will be absolutely clear. Why? They will be inside the cells. They're not in the cerebrospinal fluid. And they don't use the sugar. Your cells are using the sugar. So that is, we'll look at it, they call that actually aseptic. That means that the cerebrospinal fluid, there's nothing in it, it's clear, but they, based on the signs and symptoms, they say it's viral. And the good news is viral is usually, signs and symptoms are way, way more calmer than the bacterial fungal. All right. So now, what I'm going to do is tell you about 5 very common ones or problematic ones. And so these are one of the 3. So H. influenza, pneumococcal, meningococcal. So we're going to look at those. So here, focus on little things that I tell you that distinguishes them. First one, Streptococcus pneumoniae. Majority of the cases of meningitis are caused by Streptococcus pneumoniae. Very common in adults, okay? When you do a spinal tap, it will be cloudy, it will be low in sugar, and when you do a gram stain of it, you see diplococci gram positive. So diplococci means there's 2 of them, and there's a capsule covering both of them. And this is gram positive. If it is that, it is pneumococcal. I think I spelled it right. But pneumococcal. So you have all the signs and symptoms: cloudy cerebrospinal fluid. And when you do a gram stain is gram positive, Diplococcus. Onset of signs and symptoms is also gradual. So the person has a high fever, headache gets worse, and slowly things are progressing. Treatment, antibiotics. I don't have it up there. Most bacterial infections are antibiotics. So this one responds to antibiotics pretty well. Treatments is that. We do have a pneumococcal vaccine. Okay. So there is a preventative measure for it. Again, sorry that I think for these sets, my slides are kind of mixed with everything. So pneumococcal vaccine, that teenagers actually take it, kids take it at a younger age, and then you get boosters as a teenage year, and then later on actually they get it, which is almost the same as the one for the pneumonia respiratory. Prognosis for it, unless it's extremely advanced before the patient starts getting treatment, in majority of cases the patient eventually recovers and they're pretty good and they don't have any lingering issues. Next one is Neisseria meningitidis. This is what we call meningococcal meningitis. This one is extremely dangerous, and it's an extremely fast progressing disease. This is the one that you hear about on the news. Like such and such students died in that high school from meningitis. Everybody is advised to come get prophylactic treatments, make sure that they basically announce it, they call everyone in the school that was in close contact with the person. This can kill you from onset of the symptoms, kill you within 6 hours. So rapid progression, very, very high fever. In most cases, the person comes highly agitated, highly, like major having pain and all of that, and they fall asleep. And they don't wake up. Then you have to take them into the hospital. This one, the big difference is, it is a Diplococcus, but it is a gram-negative. So that's the key thing. When they see this as a gram-negative, they get to it really fast. Treatment is antibacterial, so antibiotics. Unfortunately, though, when a person shows even minimal signs and symptoms, in most cases, because of the rapid progression, they will get hospitalized. They will get treatments in the hospital. And in many cases, it could actually be, the prognosis could be loss of limbs, vegetative state, permanent coma, death, other issues like loss of hearing, things like that. This is the one that you see the commercials also on TV for, that you took care of them for everything and then suddenly they change scene and the kid is like, doesn't have legs and they are like, they have prosthetic legs, or they're in a hospital and they're like, why don't you give them the meningococcal? So there is a meningococcal vaccine for it that now in California at least is mandatory. So it's given usually at age 16 to 17. It covers 3 different strains and it works very well. Before, if kids are in dormitories, they are basically, they won't let them in unless they have been vaccinated for this and pneumococcal. So the vaccine works very well for it, but in some cases the minor issue is actually, I don't know if you've ever had anyone who's had this, but they basically come the cognitive damage. So it's much harder for them to, like, they can remember things, go through it, like learning processes. Eventually they can work it and it can get better, but that's just many times like the minimal damage that they can have. Things become harder for them.
Do antibiotics like automatically circulate through our CSF, or how does it?
Yes, it gets the antibiotics. Usually for a patient who's showing signs and symptoms, they do an IV. They do give it to them so it gets into the system very fast. For like prophylactic, they basically, you don't have to get an IV. So they're like, you were exposed to this patient today and the patient died today. So you take the antibiotics and by the time, it has an incubation period. So it works pretty good, the prophylaxis. All right. So this is something that it's actually report to the health services. They won't just say, oh, okay, it's just you. The whole family gets treatment, anyone who was in close contact with them, because it can be respiratory by inhaling, like it's found in the saliva and all of that, so it can be passed that way. Third one, Haemophilus influenza. It is called influenza because they thought this was the cause for influenza. When they were doing the test, they actually found it, but it can be actually a normal flora for some individuals and it can be found in the respiratory system. So they later on they realized. However, in children, it can cause pneumonia. Meningitis and pneumonia. So in children, it can be a leading cause for meningitis. For the meningitis, it is for adults with a strong immune system, typically, no. Just it can cause maybe a little bit of a respiratory issue and then they're fine with it. But in children, it was one of the #1 causes for them to get it because it would be passed on, respiratory passing on to one another, and they could get it in close contact. It wasn't, sometimes it could lead to minor brain damage and all of that. But the good news is there is a very safe vaccine that was developed many years ago. And the vaccine is like now mandatory for all the children. It's actually one of the first ones that even the newborns get it immediately. It's one of the among the first ones. This basically is showing you how the vaccine, and the name of the vaccine is Hib, Haemophilus influenza type B. that in 2000, less than 300 cases in United States. So considering our population, that is almost eliminated. So the vaccine is very good. So Haemophilus influenza, associate this with the used to be number one cause of meningitis in children. It could cause minor diseases. However, now it is almost semi-eradicated because of the vaccine. The name of the vaccine is Hib, Haemophilus influenza B. Treatable, very nice treatable, kind of same signs and symptoms. Treatable, especially when you get to it fast, not any issues. Listeria monocytogenes. This is associated with immunocompromised individuals or a fetus. Could cause swelling of the brain in the fetus. This is associated with oral fecal, is via food. 2 years ago, cantaloupes. Everybody was advised to either get rid of their cantaloupes or brush the cantaloupe and wash it really good with warm water and soap and all that before peeling the cantaloupe. Sometimes it could be associated with our vegetables and all of that. The thing is, for it is associated with that. Like I said, in a healthy individual, it shouldn't cause any issues, but in immunocompromised, then it can cause meningitis very easily. The bacteria is very funny in its spread. It goes inside of the cells and it creates vesicles for itself, and from one cell goes to another cell via the vesicles. So that's why the immunocompromised, for their system, they fight it much later. It responds to antibiotics very well again, so, and typically, unless it's a fetus, we don't have, or it's treated late, we don't have any bad prognosis from it. So for this one, associated with food. Meningitis associated with food, immunocompromised, and fetus. Last one is Streptococcus agalacetiae, or group B streps. This is associated only with newborns. Group B streps can be found in vaginal tract. It can be a normal flora of the birth canal. So a pregnant woman will never get vaginal exams except for the last month and right at the delivery. They will take a swab to see whether or not they have the group B strep there. If they do have the group B strep, then the mother is given IV antibiotics so that it will get into her system real fast and it will get to the baby. And then when the baby is born, they're given antibiotics too. So as the baby goes through the birth canal, they can inhale this and it can cause meningitis in them, and it could have caused permanent brain damages. But with this prophylactic treatment, actually the percentage has come down lower and lower, and it is only if they are going through natural birth. So C-section doesn't matter because they don't get to the birth canal. And a woman might be positive one time, next time she might be negative, or vice versa. So they will check them every time. Okay, so 5 of them. First one, pneumococcal, Streptococcus pneumoniae. Gram-positive Diplococcus, a very treatable. Onset of signs and symptoms is gradual, very treatable. There is a vaccine for it, and typically not any lingering issues. Second one, meningococcal one, Neisseria meningitidis, gram-negative Diplococcus, very rapid onset of signs and symptoms. Prognosis, always there is a damage, somehow even minimal to extreme and death. There is a vaccine for it, and the vaccine covers 3 types of it. Then the Haemophilus influenza, children, associated with children. It usually responded good with antibiotics, but again now we see it less and less because of Hib, HIV, the vaccine. Listeria associated with food, usually immunocompromised fetus. And then the last one, strep B, associated with newborns only. Prophylactic treatments. All right, next bacterial infection is what we call Hansen's disease or leprosy. They try not to use the term leprosy because of all the awful history of this disease. The disease is caused by Mycobacterium leprae. Unlike its sister, Mycobacterium tuberculosis, or in the same genus that causes TB, this one is very difficult to spread. So it is an infectious disease, but it is difficult to get it from one person that has it. Typically is blood to blood associated, like through a scrape on the skin and then getting that person's whatever infected fluids and then getting it to you. So when a person with Hansen's disease or leprosy shows up to a doctor's office, they're not going to go crazy like if a patient with TB shows up. They won't clear the area and everybody gets treated. They're fine, they'll just do the normal cleaning. It's very difficult. Because of that, in the old days, they thought this was something like God basically gave it to a special person. One person in the family had it, and usually this was the person that was more out there and doing all these different things. And you know, the more you were out there, the higher the chances of you to get this disease. So they would burn them, they would bury them alive, they would take them to special islands and leave them there. If it was in the city, they had to wear bells and all of that to let everyone know that they are going around. So because of that, they tried to use Hansen's then after the person who discovered it. Now, the bacteria is a Mycobacterium, so it has mycolic acid on its surface, on its cell wall. Therefore, it's an acid fast. It's a positive acid fast test. We don't do gram staining, we do an acid fast for it. Second thing about the bacteria that is interesting, it is an intracellular bacteria. Genus of Mycobacterium, they are intracellular. So they will go inside of the cells. For these, one of their favorite sites is actually macrophages. So they remain in the macrophages. They like usually the cold areas of the body. And finally, one of the other interesting facts specifically about Mycobacterium leprae is the fact that we have not been able to culture it in a laboratory. Even using cell tissues and all that, we have not been able to culture it. Now, the disease manifests in two forms, depending on the person's immune response. So since it's an intercellular bacteria, and it especially likes macrophages, depends on the person's immune response. The first one is tuberculoid leprosy. This is when a person has a very strong immune response. And when they produce an immune response, they would produce also both antibodies mediated, so humoral mediated, and their cytotoxic T cells also get activated. So even macrophages that now have the bacteria growing in there, they can actually get rid of it. So it's a much stronger. In these cases, the symptom is typically associated with the neuron that it has been infected. That neuron, because it's being attacked, it basically loses normal function, so it's the loss of sensation in the area. Most often how the person realizes is they do something extreme in one area and they have no sensation of it. Meaning having a deep cut, burning themselves to the point that they smell the burning flesh but they didn't feel anything. So extreme measures that they know they should have had a pain reaction but they don't, and they show up and then they find that. Lepromatous leprosy is actually the one that is the more severe one that people didn't like, and in the old movies or in the movies they show them like they are covering with bandage and all of that. Half of the face is like scarred and they're losing it, fingertips. these individuals have just their B cells activated, so they have a weaker immune response. This weakened immune response then causes basically for the disease to spread faster. Because of lack of nervous response in the areas, damage to the tissues happen, and they basically end up seeing necrosis. So they can basically start losing tissues. They have scarring in the area. So one of the nicest pictures is the one that I have here. So they start losing their tip of their fingers and all of that. Why? Because they don't have the sensation that you and I have. When they put pressure, when you put too much pressure on your fingers, if it's uncomfortable, you remove your hands. These individuals do not. And then the lack of nervous response eventually can lead to necrosis in the areas, damage, little damage, and they lose it. We don't have that many in the United States. Typically, we see it as individuals that have come from Asia, the continent of Asia, then also some regions in tropical regions, they can have a lot of this. Treatment, long-term treatment, because it's mycolic acid, so you have to make sure you treat it so you hit every single dividing bacteria. Mycolic acid is very hard to produce, so some of these bacteria may be produced once a week or so. Because of that, treatment should be about sometimes it can be up to 2 years. Side effects and all of that make people stop the treatment. That's one of the reasons the disease is still out there. We don't have a vaccine for it. There is a vaccine called BCG for tuberculosis, which is not a really good vaccine. They think it might provide some immunity, but again, it's not a good vaccine at all. All right. Next disease, botulism. The organism is Clostridium botulinum. Clostridium species we saw one of it in gas gangrene, Clostridium perfringens. So these species, the genus of Clostridium is anaerobic spore producing. Okay. Quite often the spore gets into the body and then it germinates and causes the disease. Clostridium botulinum is what is problematic about them is the 7 different types of neurotoxins that they produce. The 30 gram that I have there, 30 milligrams, or no, 30 grams. It's basically the size of one of those sugar packets. They have 30 grams of sugar in there. That much of the toxin, especially the strongest form of the toxin in water treatment plant, is enough to get rid of the population that is using that water treatment plant. This is the one that is associated with swollen cans, that they tell you if a can is swollen, get rid of it. Not dented, it swells up. Because the canning process is anaerobic. So if somehow the bacteria survives, the spores survive in the canning, they basically reproduce, they have a ton of nutrients, and they produce the toxins. In these cases, for most adults, the disease is actually an intoxication. They consume the contaminated food with the toxin in there. So the signs and symptoms are very fast and immediate, which start with sore throat, stomach pains, then severe abdominal pain, difficulty breathing, difficulty using, like starting to have like inability to use the fingers and starting to see flaccid paralysis here and there, double vision, and then eventually basically if it keeps going, the person can't breathe and they die. At all these times, your brain is functioning very well and your heart is beating very well. The heart muscles, the way the neurotransmitters get to them is totally different than the rest of your body. So it doesn't affect heart muscles. What it does, it actually, and then I'll talk about the infants. What it does actually, it goes to your peripheral neurons, the end of your axons, the axon terminus, where neurotransmitters are supposed to be released. They actually cover that, and they prevent neurotransmitters being released that allow for contraction. So a flaccid paralysis ends up happening. In infants, what ends up happening in most cases, for us, if we take in the bacteria itself or the spores, our stomach acid is strong enough to destroy it. But in infants, they don't have much of a stomach acid and they don't have normal flora. So consuming the bacteria or the spores gets into their intestinal tract. Intestinal tract is basically anaerobic, in an anaerobic environment. And it will reproduce there, so the onset of signs and symptoms is a while after infections and incubation. There's an incubation period. This is why they say don't give babies honey or things like that that they're not washed or pasteurized. Okay. The two images that I have up there, even a baby, a newborn, our head is so important to us that even a newborn where their muscles are so weak, if you hold them like this and raise them, they will try to bring their head up to protect their brain. And when you put a baby face down, even though they're not seeing that well, they sense that they are in danger, so their hands and arms go out like that, like they're ready to fly. Because they are like, oh, I'm gonna fall, so they're ready to act. They do that. But in a baby with botulism, that's completely gone. So the person eventually basically dies because the diaphragm becomes paralyzed and they cannot breathe. They cannot inhale and exhale. So, treatment. And diagnosis, signs and symptoms and all of that. Treatment, immediately giving them immunoglobulins. So anti-serum for the toxins are given. Then antibiotics. In case of children, or sometimes adults can get it from wound, but that's very rare. That wound has to be very deep and all of that. Removal of the site of infection. So for babies, you need to wash and rinse their intestinal tract to make sure the bacteria is there. Then they give an antibiotics to get rid of it, all of that, anti-serum for a while, and then they are put on ventilators. So the good news about this is once you get them there fast, ventilators can actually breathe for them and allow them to recover. Now, recovery is this. This is irreversible, but the end of neurons have the ability to kind of, if this end of neuron, like the axon terminus, is damaged, they can actually use other parts of that axon and use that and change that, the makeup of it, and make that the axon terminus. That's why every time like you do a minor cut and all of that, you still can get the sensation back. Or you've seen people who get Botox. Botox is actually one of the neurotransmitters, the weakest one. So you've seen that the individual after a few months, it goes back because that, first of all, is the weaker one. So the neurons actually repair themselves and they create another axon terminus. So they have to keep getting this Botox for a while. Okay. Tetanus is the next one. Again, it's a Clostridium genus, Clostridium tetani. This time the bacteria produces a neurotoxin that does exactly the reverse. It causes the contraction of every single muscle. It prevents muscles from relaxing. So it prevents the neurotransmitters from coming out that cause muscle relaxation. So it causes contraction of every single muscle that you have. Again, it does not affect the heart or the brain. So the brain is totally conscious, is aware of what is happening. It is also called the lockjaw disease because one of its first signs and symptoms, the person's mouth clicks. They can't open it. It's like your jaw has been wired. Then you typically have, it will always happen with wounds and all of that. Then you have itching at the site, starts there. You have a fever that it's an ongoing. You can have locked jaw, little tiny spasm, and then the spasms get worse and worse to a point that basically your big bones, it snaps it like a twig. This is when a person dies from it. So every single muscle contracts. The awful thing about it is your diaphragm contracts, so therefore you cannot exhale. So when your diaphragm contracts, your chest cavity opens up, you inhale, but you cannot exhale. And we cannot put a person on a ventilator on this. They can use at the beginning some of the Botox for some form of treatment, but again, depends. This is again not also showing you how every muscle is contracted. Treatment, again, we start with immunoglobulins, then washing the wound area, making sure the bacteria is not there, giving antibiotics, maybe using Botox if it's right at the beginning to take some of the muscle spasms away. But unfortunately, if it continues and if it's somewhere in the middle, past the point of huge spasms and all of that, it's very deadly. And the person, you can't do anything for them. It will progress. The good news is there is a very good vaccine for this. Now, pay attention. First time you get it is DTaP, diphtheria, tetanus, P. pertussis. Again, it's for neurotoxins, and then for the pertussis also has a toxin, diphtheria has a toxin. That's the first time. After that, you will get boosters. The boosters are Tdap, more oriented toward tetanus. So you got to know the difference. As a healthcare provider, DTaP, Tdap. A person's immunization history has to show that, okay? The Tdap has to be every 10 years. Because for tetanus specifically, we lose immunity. All right. Viral diseases. So we're done with bacterial, viral diseases. The good news is virals tend to be more often cause of issues directly because they're small and they can get past. The good news is that in most cases they are rarely fatal. So the bad news is we don't have much treatment for it. All right, so they occur more often. First is viral meningitis. So this is also called aseptic meningitis because the spinal tap is clear. So it looks like there's nothing there. The signs and symptoms are also very mild. There is no treatment, just supportive treatment. But again, pretty much majority of individuals, unless they have some other issues, they recover from this without any permanent damage. You don't even have to be hospitalized. Most of the viruses that cause this are enteroviruses. So they start in the digestive system. Mode of action or transmission is most often fecal-oral by taking contaminated food, drinks, things like that. Again, treatment, no specific treatment, just supportive, and that's it. Poliomyelitis, or just polio. This is a viral disease. Again, it's an enterovirus. Poliovirus is an enterovirus. So it is, again, mode of transmission is fecal-oral. What it eventually basically does, it can affect the muscles, myalgia, and cause damage to the interaction of the nervous system with the voluntary muscles and some involuntary muscles. Majority of the population is asymptomatic. So they can have this, their body fights it, does not show any signs and symptoms. About a very small percentage, 5%, minor polio. The minor polio is funny, the signs and symptoms are weird. So you could have a little bit of fever, most often vomiting. It starts with vomiting and even sore throat, and maybe muscle pain. So just like a flu with vomiting associated with it. And the vomiting is not severe. Like you wouldn't mistake this with norovirus, or what we call stomach flu. We don't mistake it with that. But it is like they vomit at the beginning, and then it goes away, and then they have fever and muscle pains and all of that. And then they recover from it. This is why we worry about polio. Non-paralytic and paralytic polio. Non-paralytic, about 2% or so, a little bit more. This one, the minor polio, the signs and symptoms, they start with that, with this, sore throat, vomiting, and then not feeling good. And then it starts with severe muscle pain, especially in the back and legs and all those areas, that they don't want to move at all. They don't want to go anywhere. They don't want to get up. They don't want to do anything. It's very hard for them. And they may have some minor muscle spasms here and there. Paralytic starts with non-paralytic symptoms, and then suddenly they become paralyzed. In most cases, it tended to be from the waist down, so the legs. It happened in the legs. Some cases, it was from neck down. And they basically have to put that person on a ventilator machine. In some cases, again, the person recovers, mostly, especially even if they are in the like limbs. They just had paralysis in the limb. They eventually recover and regain some movement, but it's not as great as before. Perfect example, FDR. Okay, so he had the paralytic one. He ended up regaining, but as he was getting older and older, that became worse and worse, and he was on a wheelchair. At the beginning, he could even stand and use braces and stand and all of that and walk even with it. But then later on, it got worse. And then for some individuals, they would never recover and they would die from it. Non-paralytic ones, some of the prognosis is the individual, this caused like basically one muscle to one side of the body, the muscles grew thinner than the other side. So the legs would be thinner than the other side, or shorter than the other side. So things like that, they would have issues like that because of the non-paralytic.
Would it stay that way?
Yes, it stays that.
You see sometimes people with those heels.
And you ask them and they go, because I had polio. Or they have one arm that is much, much thinner. It's almost like bones than the other one. So they can have that. I have some images. So this is basically, this was their ventilators. They were called the iron machine, the iron lungs. So they would have to be in there, and that machine forced their chest cavity to breathe. They couldn't see anyone, so they had mirrors up there so they could see others walking around. But now we have those little ventilators that we have. So I thought I had an image. Yeah, see, like one leg shorter than the other, one is thinner than the other. These were all some of the non-paralytic ones. All right, the treatment, we have no treatment. It's just supportive. But then the vaccines were developed. We have two types of vaccines. The Salk or IPV. This is the dead vaccine is intramuscular poliovirus vaccine, and then Sabin, which is OPV. This is the oral polio vaccine. In United States, we just use IPV now because the oral one is attenuated and it is a chance for it to revert back.
How do you diagnose polio?
Based on the basically signs and symptoms, and then they can actually do an antigen genetic PCR, they can do ELISA. Yeah. Back in the old days, they would have it coming through and going away. So, because people weren't vaccinated. But nowadays, especially in vaccinated areas, you basically use those diagnostic methods. All right, rabies virus. We call it the bullet virus. So the name of the virus is rabies also. The capsule looks like a bullet. This is specifically a zoonotic disease. Zoonosis, it is passed to humans from animal reservoirs, either through their bites or scratch, saliva, interaction with their saliva. Depending on the area, it could be anything. It's usually rodents, small mammals, it could be cats, dogs, anyone from their family. The virus basically gets from the scratch area, again, penetrates the area, goes to the muscles, replicates the muscles, then from the muscles goes to the neuromuscular junctions, enters the neurons, and it can get eventually to central nervous system. And then it will come back from central nervous system to peripheral nervous system, and from there it actually will be secreted through the salivary glands. So humans can actually pass it to another person too via their salivary glands. But typically by the time they are getting there, they're showing all these signs and symptoms, and people know that they have it. The incubation period of this virus, key thing, you need to know this. Incubation period could be a month or more. A month or more. This is why if a person worries about getting infected on a trip, they say, no worries, go back home. You're going back home in a few days, just go back home and deal with it at home. So, signs and symptoms. Starts with paining and itching in the site, and then you have neurological issues. Anorexia, neurological anorexia, this is not psychological. The loss of appetite is called anorexia. Hydrophobia, it's not like they see water and it scares them. No. Even swallowing your own saliva becomes very painful. So they don't want any fluids. They stop taking in fluids. And then eventually it starts causing like hallucination, muscle spasms, and once it gets to these points, like from the preliminary signs and symptoms, if the person is showing hallucinations and all of that, that means their central nervous system is affected. Once central nervous system is affected, there is nothing you can do for this person. Death is imminent. So for treatment, immediately you give them immunoglobulins against the virus. Since it has a long incubation, after the dosage, high dosage of immunoglobulin, then you vaccinate the person immediately. That immediate vaccination causes the person's immune system to get activated, and within 2 weeks they have produced their own immunoglobulins. Meanwhile, you watch them, and if you need to, you keep giving them immunoglobulins. That's the only treatment we have for it. The vaccine for individuals who are prone because of their job to getting it, they usually vaccinate them, like, animal control people. And dogs and cats are supposed to be vaccinated. So it is possible for a human to pass it to another human if they are at the stage of releasing it through their saliva, just by sharing stuff. They don't bite others. but, all right. Arboviral encephalitis. So these are, we call them arboviral because they're arthropod borne. Arthropods, mosquitoes. So they are zoonotic, and typically what passes it to humans is via a mosquito bite. That does not mean that you find it only in the mosquito. We will find it in other animals too. The ones that we are going to pay attention to here, because we see it a lot, is, sorry, I forgot. These are the two. Zika virus we're going to look at, and then also we're going to look at West Nile virus. Zika, if you recall, this was the one before COVID. So we're talking about 6 years ago, I think. Suddenly, it went crazy throughout the United States, traveled to Brazil, to all these places. South America became crazy if you were like thinking about having children. So the virus is called a Zika virus. It is a virus that is passed to humans by this specific mosquito. It's called a leopard mosquito, or it's called the Aedes aegypti or Aedes mosquito. So it passes this to us. This mosquito is way smaller than our regular mosquitoes. So usually screens and all of that have to be very nice and thin in order to prevent it. When it basically, for an adult, it typically didn't cause any issues. A healthy adult would have maybe not even any symptoms or some minor symptoms that basically some muscle joint pains, skin rash, and conjunctivitis. Conjunctivitis is red, the pink eye. Okay, so. But what it ended up happening is during the gestation, it will pass the placenta, and it causes what we call the congenital Zika virus syndrome, microcephaly. So for these babies, basically what ended up happening was they will have a smaller head and smaller brain. So obviously with that, they're born and they have all these other signs and symptoms associated with it. Seizures, irritability, involuntary movements, they wouldn't function, brainstem dysfunction, so they would have that. And the thing was, the mode of transmission was also sexual transmission, which is weird for most of these. So from human to human was possible via sexual intercourse. Not respiratory, but sexual intercourse. So it was basically individuals who were in the areas that Zika virus and Zika disease was happening. They were told to not have a baby for up to 6 months, make sure they get tested to find out whether or not they were exposed. Again, treatments, basically nothing you can do for it. Some patients afterwards had Guillain-Barré. Guillain-Barré, it's a French word, Guillain-Barré. Guillain-Barré syndrome is a disease that basically individuals do this. You see it every now and then associated with the flu vaccine too. The muscle, the neuromuscular interaction becomes faulty. So either the person can become paralyzed for like a short period of time, or the muscle does weird things. Like they want to move their hands this way, it actually goes the other way. And they can't hold things properly. The good news is people recover from it and it goes back to normal, but it takes a while for it to go back to normal. So Guillain-Barré was there. Again, no vaccines so far, just treatments was just supportive. There is no specific treatment for it. All right, the next one is West Nile virus. West Nile virus is also passed to us by mosquitoes. We actually can have it in our area a lot. A few days ago, somebody died from Placerville?
Yeah, El Dorado County.
Yeah, El Dorado County, I think it was Placerville. They died from West Nile virus. It can be found in horses, birds, and then passed to us via mosquitoes, regular mosquitoes. The virus, though, in majority of the population, they are asymptomatic. Some individuals may have mild flu-like symptoms. Less than 1% it causes brain swelling and encephalitis, which is the swelling of the meninges, the brain, central nervous system, and things like that can be deadly. So less than 1%. That's why you don't hear about the death. But typically that less than 1% happens in elderly, children, people that have their immune system is still weakened. So less than 1%, same thing that you saw with polio. In a high population of susceptible individuals is not acceptable. So that's why they keep checking it and tracking it and making sure the mosquitoes, are the population in the contaminated mosquitoes doesn't increase. Supportive treatment only. Really, there's nothing to do for it. There is no vaccine for it. The only prevention we have is getting rid of the mosquitoes and mosquito eggs, either by spraying or now they're trying to find new biological ways and methods to get rid of the mosquitoes. In other areas of our country, we have Eastern equine encephalitis, like triple E, double EE, all of these. So they are the different ones different in the different parts of the United States. Other preventive measures were mosquito repellents and things like that. All right, fungal diseases. Not a whole lot because they're huge. Mycosis is very rare. However, we do have the shrooms. That's not an infection. That's, again, using the actual hallucinogenic qualities of mushrooms that can cause hallucinations. But in most cases, if it gets to central nervous system and it's an infection, it typically starts either in the lungs or peripheral regions. So it's very rare to have that. We're going to look at one fungal infections. That's fungal meningitis. The causative agent is Cryptococcus neoformans. The good news is a healthy person will inhale the spores of this, gets a little dry cough for a while, and the body kicks it really fast. The issue is immunocompromise. It was one of the predominant causes of meningitis in patients with AIDS, where their immune system was low. It is actually found because the reason I'm saying the good news is because fungus is very hard to stop. Fungus, when it happens, it spreads everywhere. It is actually associated with birds and their nests. This is why elderly are basically told if they are they like to keep pigeons and all of that, after a certain age, they're told stop doing that. Or if you're doing it, wear very good masks because then they can get respiratory, from respiratory they can get meningitis. Immunocompromised individuals, again, are told basically avoid interacting with birds, nests, and things like that. Treatment responds very good to antifungal, amphotericin B, 5-fluorocytosine. Those respond very well to it, and an immunocompromised individual needs treatment. Like I said, most often for a healthy individual, it's like a little dry cough that goes away by itself, never even reaches meningitis. Protozoans, these are extremely rare. These are the ones that every now and then you hear about it on the news, and they're called brain-eating protozoans. So the two typical ones are Naegleria and Acanthamoeba. So they look like an amoeba. Typically you get it from fresh waters, and in most cases it is via the sinuses or the tear ducts near the sinuses. It can actually get there. Very rare, you don't hear about it. Unfortunately, if it gets up there, death is pretty fast and there's nothing to do with it because they're huge. So they will, as they're moving around, they damage the central nervous system and you can't do anything. So the person will die from it. This is the ones that you hear, like the kids got it because they jumped into,
Yeah, there's some hot springs up on
Yeah.
eastern Sierras that you're not supposed to submerge your head.
yeah, they say don't do it. So, but it's very rare. If it's there, it's fatal. So 1989 to 2003, only 25 cases. That's very rare. All right, last one for us, prion disease. So we've kind of talked about this when we talked about prion to death. Again, reminding you guys, this is a proteinaceous infectious agent. It is a protein called PRP. PRP is actually a signaling protein that all mammals produce, and it's required for normal functioning nervous system. At some point in time, we don't know the evolution of it, some of these PRPs changed configuration, their 3D configuration, and the one that causes the prion PRP is the one, or the Scrapes PRP is the one that has a totally different 3D configuration, which does not function normally, and therefore precipitates and causes the death of the neurons in the central nervous system, which leads into a type of disease which we call spongiform encephalitis. The ones that humans have, that spongiform encephalitis, we refer to it as Creutzfeldt-Jakob disease, CJD. Signs and symptoms, I've told you guys before. It's like a person has Alzheimer's, dementia, Parkinson's disease, and all of these other MS and all of that. Put them together, onset is fast and progression is very fast. The person with CJD will die in less than a year, and there is absolutely nothing we can do. How it gets into their system, it could be organ transplant, transfusion, consumption of contaminated meat, which causes variant CJD, next slide, using surgical tools or needles and stuff that are contaminated, things like that. So very progressive, very fast. This is a brain of a person who has CJD. So the cross section of it. It seriously looks like a sponge. That's why they call it spongiform encephalitis. Then as far as the variant CJD, so this is what mad cow disease, we refer to it. So it started appearing by consuming meat of contaminated cows and beef and all of that. So they don't know what's the incubation period for it. So still to this day, in the United States, they choose not to get blood from individuals that were there during the time that is spread through the Europe. Again, prevention, just get rid of the meat and complete incineration of the cattle that have it or sheep that have it. I think that is it. All right, guys, so that's our chapter 17. Again, Wednesday we will be on Zoom. So I am here in the morning, but then I will go to my office and do the Zoom from my office. I will put it in the announcement, if not tonight, definitely tomorrow, the Zoom address and everything, how to get it, all right? Since I won't see you face to face, most of you, you're gonna have that dark window for me on the Zoom. Happy Thanksgiving. So hopefully you guys enjoy yourself. Oh, the exam, I'll talk about it on the Zoom, but so we have the exam the Monday we come, so come directly here. We have the quiz. I'll wait a little bit, ask if you guys have any questions about the lab. Take the quiz, shouldn't be that long, it's a fast quiz. Then again, give you guys a little bit of break so you get out of the lab to get back to the lecture. Lecture is purely Scantron, no writing, so it's all multiple choice, okay? So test yourselves, quiz one another, use signs and symptoms to kind of say, okay, what disease do you think I have, and this and that, and create your own little case studies, things like that, to study together, all right? and re-listen to the lectures when I tell you this is how you distinguish this from that. I'm not joking. I'm using those things. So keep to my PowerPoints. My PowerPoints are important here because everything should be on PowerPoints. Nothing that I ask will be outside of the PowerPoints. If I don't talk about the disease, I don't cover the disease. If I don't talk about specific issues on the disease that is in the book, then just stick to things that I'm covering in the class. All right, so that's it. Use the book to just kind of look at images and things like that. All right, guys. See you on Zoom on Wednesday.